All right, so we've discussed low flow devices and so forth. High flow devices, you may set up a tracheostomy collar, a face shield or face tent for a patient, and an aerosol mask. You've got different types of air entrainment devices that can be utilized for this today. I mean, they all pretty much function essentially the same way. What you'll notice is if I'm utilizing this apparatus, the corrugated tubing slips over this end, the oxygen tubing goes over this end, and then the other end of that obviously is going to attach itself to the oxygen flow meter. And then you can adjust your liter flow based upon the recommendations listed by these devices here, or if you understand the system, you can ultimately titrate to make sure that you are meeting or exceeding the patient's peak inspiratory flow demand. So for instance, you'll notice that as I turn this dial, this window right here opens and closes. So obviously the higher the FiO2 or the FiO2 or what you want, the FiO2 is going to be the delivered amount of oxygen. The FiO2 should be what the patient's actually going to inspire. And this is going to be where all those air to oxygen entrainment ratios and understanding that are going to come into play. And I'll provide you with a clinical scenario that I encountered as a respiratory therapist that, I'm glad I was there to witness it because it became a teachable moment, but also it could have been a pretty rough time for the patient that was attached to the system later on had nobody called it when it had occurred. But the way that these items work is you're going to attach them to an oxygen flow meter, and then you're going to adjust this apparatus to the desired amount of oxygen that you want the patient to breathe in. So for instance, if I were to set this to say 40%, at 40%, it's going to adjust this window. The lower the percentage you go, so this one will allow me to go down to 28%, the bigger the window gets. Why is that? Because it's got to pull in more air, 21% that you and I are breathing in, to dilute the 100% oxygen that's coming down out of the flow meter. So we've got to make sure that we are aware of that. So then obviously on the flip end of that, the higher the percentage of oxygen that I set, so this one will allow me to go to 90%, you'll notice that that window is essentially closed off, because at this point you want 100% oxygen or 90% oxygen going to the patient. But you've got to be careful with that, because obviously the less air that gets entrained, the more dependent upon you are what the liter flow of the oxygen flow meter is at that point. So, and it's the same scenario, just if you happen to have different devices. So this happens to be a 40% Venturi, this happens to be 50%. So the actual entrainment windows, there's not a significant difference. 40% is going to allow more air in because it's got to be diluted down, so there's a little bit more openness here. And it also tells you to adjust your liter flow to like 8 liters per minute. Both of these say to adjust to 8 liters per minute. And that's where the knowledge of your air entrainment ratio stuff is going to come in. So like we said, you've got to have room air or 21% mixed with 100% to give you any type of percentage in between 100% and 21%. So if I take a large volume nebulizer with the air entrainment collar on it, this allows me to go to 28% all the way up to 100%. Again, here you can see at 28%, window's as big as it's going to get. At 100%, that window closes. So we are dependent upon what flow meter this is attached to, and what the flow setting that we have for the overall total output flow. Case in point, if you walk into a patient's room and you find that this large volume nebulizer is attached to an airflow meter. If it's attached to an airflow meter, I don't care what you have this collar changed to, whether it's 100%, 70%, 50%, 40%, 35%, and so on. Don't care what you change this collar to. If it's on the airflow meter, the only percent of oxygen possible that's coming through that system is 21%, because 21% mixed with 21% is just 21%. So the only way in which you can get one of these desired additional percentage of oxygen is to have this appropriately attached to an oxygen flow meter. Now, are there any scenarios in which you might actually place this on just an airflow? Let's say the patient doesn't need supplemental oxygen; they just need a cool bland aerosol, so they don't need any higher amount of oxygen or higher FiO2, if you will, than 21%. Then sure, you can put this on an airflow meter and turn the call. An understanding at that point of your air to oxygen entrainment ratios and total output flow is going to be crucial for the way that these things work. So you got to understand that. So if you depend upon what textbooks you utilize, there you can go through, do the magic box. There's other ways of figuring out, but there are some common ones that you need to know, like 50%, 30%, 40%, 35%, 28%, and so on and so on, 100%, 0%. So just mathematically, because I'm not going to write stuff out or use a calculator, I'll utilize some relatively easy ones for us to understand. So probably, so if you look at air to oxygen, and some people will do oxygen to air, but air to oxygen, the way that you read, if you're doing air to oxygen, that means and I'm going to set it at 40%. 40% comes with a 3-to-1 ratio. So that means 3 parts air to 1 part oxygen. So if I were to want to give someone 40% and I set the oxygen flow to 1 liter per minute, then that means the total amount, or that means that in order to achieve 40%, I have to match that 1 liter with 3 times that of air to bleed it in. So if you're going to utilize an old school system of taking an oxygen flow meter, an air flow meter, and blending your own gases to develop or to essentially create the amount of oxygen that you want, what I would do then, because it's a 3-to-1 ratio, and if I'm just, that would be super low flows, so, but just for the sake of simplicity, if I'm going to utilize 40% and I had a 3-to-1 ratio, and I adjust my oxygen flow meter to 1 liter per minute. And so this is 100%, 100% downstream. So if I had oxygen tubing attached here, downstream, 100% oxygen coming through that system. It's 100%. Now I want to get it to 40%. So I'd have to take another set of oxygen tubing, attach it to the air flow meter, and because I want to maintain 40% at a 3-to-1 ratio, if the oxygen flow meter is at 1 liter per minute, I have to adjust this to 3 times as much of that. So it's going to be 3 liters of airflow. So I'll turn that up to 3 liters of airflow, and if those 2 lines meet together, in theory, the percentage of oxygen analyzed beyond that point should be 40%. So we look at what is the FDO2 beyond that point. FDO2 should be 40%. This is why it's important to understand total flow, FDO2, and FiO2. Because if I have this set up at 3 liters of oxygen, 3 liters of air, 1 liter of oxygen, and I have that going through a face shield to this patient, or I have this going into an aerosol mask to this patient, or if the patient has a tracheostomy collar and I have this tracheostomy collar on the patient, I'm delivering 40% to the patient. However, their FiO2, their fraction of inspired oxygen, is likely not going to be 40% because of the total flow situation that I have here. So at 1 liter per minute and 3 liters per minute of air, combine the 2 of those together, it gives you a total flow of 4 liters per minute. That's not going to be, to be right honest, depending upon how deeply or how shallow they're breathing, that may not even be enough to flush the exhaled CO2 out of the mask. So you got to be and that's the scenario that I encountered with a pediatric patient. I had an air entrainment bottle or a large volume neb that was set up similar, and it might have been set at say 40%. And I saw a resident come into the hospital or come into the room and say he wanted to wean the O2. So he turns the O2 flow down to 1 liter per minute. that gives you a total output flow of exactly what I have set up right here, which is 4 liters per minute total. You got to have in excess of 5 to 6 liters to flush the exhaled CO2 out of a mask anytime you place a mask over someone's airway. And this kid had a tracheostomy collar. So I was glad that I was able to see it because it became a good teaching moment. And if the kid wasn't able to flush the CO2, we may have had a rapid response a little bit later if the patient became super hypercarbic and ended up, not breathing or what have you. So, super important to understand these air entrainment devices and how they work. So we'll just leave it at 40%. If I were to go 40%, still a 3-to-1 ratio, and I now turn this up to 3 liters per minute. So if we're catching on with the mathematics, you still have to do, it's a 3-to-1 ratio. So if I am wanting my FDO2 to still be 40%, I now have to turn my airflow meter up to how much? 3 times 3 is going to give me, turn that up to 9. 9 liters of air get entrained or added in to give me that analyzed FiO2 of 40%, but my total flow through this system is 12 liters per minute. So all I did was had taken a knowledge of the air to oxygen entrainment ratios, applied them to this setup here, and I'm able to blend my own system. So the purpose of me setting it up like this is so that you can actually see air and oxygen mixing together to get that. So that's how the air entrainment stuff works. If we were to, let's say I needed to bump his amount of oxygen up to 60%. Now I need to know that that's a 1-to-1 ratio. So, and let's say that I need his inspiratory flow at this point to be 18 liters per minute. Now at this point, all I got to do, I can leave the air at 9 and take the oxygen up to 9. That gives me a total flow of 18. I am matching every 1 liter of oxygen with 1 liter of air at a 1-to-1 ratio. If I analyze that, it'll be 60%, or in theory should be 60% below that. So let me turn these off, and we'll apply the large volume jet neb. And again, your aerosol tubing would hook here, your drainage bag, like I showed in a previous video, the your corrugated tubing is going to attach there. Your aerosol mask, face shield, tracheostomy collar are going to go to the other end of that. You got a bag that's capped, and it needs to be at the lowest point so that any kind of water that collects can drain in there, and make sure it's capped so that the water doesn't go on the floor and that you don't get you don't slip and fall or turn into a slip and slide or something of that nature. So we will hook this up to my flow meter. Slide this out of the way because that's getting in the way of me being able to hook this large volume bottle up. All right, so now I'm going to have the option to turn this to 40%. So I'll turn that to 40%, and if I turn this oxygen flow meter up to 5 liters per minute, and you can hear a difference when I cover that entrainment port up. You don't hear as much oxygen going in through that system. Reason being is because I'm covering the entrainment port up. So what is happening, that window is opened wide enough so that as this 5 liters of flow runs through this bottle, it's going to pull in enough air to mix it so that the amount of delivered oxygen is going to be 40% that I'm set at. So if you remember, it's a 3-to-1 ratio, and I set the oxygen flow meter at 5 liters per minute. How much room air is it pulling in? That's right, 15, because 3 times 5 is 15, so that's it has to take in 3 times as much air than it does oxygen. So for every 5 liters of oxygen, or for every liter of oxygen, it's got to pull in 3 liters of air to give you that 40%. However, the total flow through the system at this point is 5 liters plus the 15 is going to be 20 liters. If you look at a normal peak inspiratory flow for patients, it might be in the ballpark of 30 to 60, 40 to 60, 50 to 60 liters per minute. So even at this point, the FiO2, so the FDO2, the delivered amount of oxygen going to the patient, 40%. But the amount of inspired oxygen could potentially be less, because if the patient is breathing in greater than the 20 liters per minute that we have entrained, then they're going to pull in room air, and that's going to dilute that 40% down. So we've got to make sure that we meet or exceed the patient's peak inspiratory flow demand. That's why when we have stuff like these things that'll tell you to turn it to 3 liters per minute, 5 liters per minute, or what have you. Now keep in mind, the lower the percentage, the greater the pull of air is going to be. But I tend to always tell people, turn the flow meter up. Because the higher the oxygen flow, the greater the amount of air that's going to be entrained, but it's going to maintain that air to oxygen entrainment ratio at 40%. So I can do it. Now, how do we gauge the peak inspiratory flow for our patient? You know, there are ways in which to go about taking it, but if I've got an aerosol mask on here, a face shield mask, and I place this on the patient with the corrugated tubing hooked up to my large volume neb, and this is full of water, I'm going to see aerosol come out over this mask. You should see the aerosol spill over the mask. When the patient takes a breath in, if you see the aerosol go away, that's your clue to turn up the flow, because the output flow of this system is not meeting or exceeding the patient's peak inspiratory flow demand. So I know that you've got the nuts and bolts of your magic box, doing your air to oxygen entrainment ratios and actually working those out, but I wanted you to actually physically see it in action. So now, we'll stick with another symbol. We'll do 60%. That's 1 to 1. I will not change the liter flow. So the liter flow will stay at 5 liters per minute. All I got to do now is switch this collar to 60%. So if I switch this collar to 60%, you heard a change, a little bit of a change in intensity, because at 40%, at a liter flow of 5, our total flow through the system was 20, because it's a 3 to 1 ratio. I've switched this to 60%. So we'll notice that window closed up a little bit, because it's going to entrain a little bit less air with it. So at 5 liters per minute, this is only going to pull in 5 liters of air. So 5 liters of oxygen at 60% and a 1 to 1 ratio, going to pull in 5 liters per minute of air. So so by going up on the FiO2 to 60% from 40% and never adjusting the liter flow, I actually decreased the total flow going to this patient. I cut it in half. There was 20 going to the patient. Now there's only 10 liters per minute of flow. So going off of FDO2 versus FiO2, if this patient's peak inspiratory flow demand is, say, 40 or 50 liters per minute, and I'm now only providing 10 liters per minute of 40%, when they breathe in, that's going to be 21% that mixes with that 60%, and it's going to be even less. So yes, I'm delivering 60% to the patient, but are they breathing 60% in? Probably not. How do you fix it? Crank your flow up. Crank it up as wide as it'll go, and then that will entrain the most amount of air, so that it increases the total output flow to your patient. And then obviously the air entrainment ratios will differ. So for instance, the same thing. Somebody might say, well, they need 100%. So if this thing is at 5 liters per minute, and I'm going to say, well, they need more oxygen, got to get more oxygen, let's take that to 100%. Now, I've even cut the total flow to the patient down even more. It's because now it's not entraining any air. It's just 5 liters of oxygen coming through that system. So 5 liters of 100% getting to the patient, but as they breathe in the room air, that's going to be significantly less. I hope you find this helpful.